Dogs are well known for their undying devotion. No matter how bad things get, they seem to be the one member of the family that you can always count on for love and support. But when your pooch is suffering from the most common form of pain in dogs, osteoarthritis, communicating their needs might not be so easy.
I noticed Rock had a problem because he was limping on his front leg, and sometimes he would actually not put any weight on his front leg.
He jumps into the back of my SUV. When he couldn't do that, I started noticing that there was something seriously going on.
But recognizing that a dog is experiencing joint discomfort or pain isn't always so obvious.
Some of the indicators of pain are a change in behavior. Oftentimes, owners comment that their animal's slowing down, acting older. Quite oftentimes, they have trouble rising or very stiff on rising, and they may be reluctant to climb stairs.
According to Dr. Beal, detecting a health issue early can be very important.
Osteoarthritis is secondary to some other problem, and ruptured cruciate ligaments or hip dysplasia, elbow dysplasia are common examples. And if we can prevent arthritis by treating these underlying conditions early, it's much better than trying to treat it after the disease occurs.
Once arthritis has started, taking steps to stop its progression is next.
When we treat arthritis, we use a multi-prong approach. One of the most important things is getting the animal in the proper body condition. So if they're overweight, we certainly want them to lose weight. Other things that we want to do are exercise, and we want to go for moderate exercise like walking or swimming. Dietary supplements can also help, the chondroitin sulfates and glucosamine, for example. And lastly, the classical treatment is using a medication like a non-steroidal anti-inflammatory drug.
Recently, scientists have developed a new class of non-steroidal anti-inflammatory drugs, or NSAIDs. The Coxib class, used in human arthritis medications, specifically controls enzymes responsible for pain without damaging beneficial enzymes. With FDA approval of Deramax, specially designed for dogs, veterinarians now have access to the same class of drugs.
The evolution of NSAIDs in dogs has paralleled that seen in man. First we had aspirin, then we went up to products similar to ibuprofen, and then now we have the Coxib class of drugs. And the special thing about this class of drugs is that it targets the enzymes that cause pain of arthritis. And it's really become a very important tool in our treatment of arthritis in dogs.
Since Rock has been on the pain medication, he's a different dog. He's become a member of our family again. He's wanting to play with our other dog. They play tug of war now, and he's not limping at all on his front leg.
It really helped him to act more like a puppy, and was really heartwarming to see him act like that. It was really good.
While dogs may not be able to elaborate on what a good quality of life means to them, if you pay attention, you just may discover some telltale signs.
Personally, I'm very, very excited about Deramax. I've had opportunity to work with it on an experimental level as well as on a clinical level, and the reason why I'm excited is it gives me another choice to treat these dogs that are suffering from pain and arthritis, and Deramax seems to be one that they tolerate well, and I get good effects from it.